Well, good evening, first of all. How's everybody? Everybody good?
Well,
I'm glad you're here together. I'm Eric Dillner. I'm the CEO of the Shoreline Arts Alliance. And as I think most of you know, the chair of the task force to reopen Connecticut arts venues through science-based safety with my compadre, Sten Vermund, who's been just absolutely the belle of the ball along this whole process. What I thought we'd do tonight is also try to be a little less formal, actually a lot less formal, and try to answer questions as we go. But I thought also we should probably keep our standard, use the chat to share information amongst yourself if you want to. And if you want to throw things in the Q&A, if you just feel like we're not quite on it, you don't want to pipe in, or that's just a good way to get it recorded so that if we don't get an answer tonight, we can continue to look for information. We'll use both of those. But also let's use that button, raise your hand button, if you'd like to talk. That would be great. I think that would be help us all. All right, so Sten, I want to set the stage a little bit for you. Carol actually sent me a bunch of really great questions. Thank you for doing that. And so it also helped me kind of reach out to other folks and let's get a sense if we're really all on the same page or if I'm making this up. But I think what I've learned from many of the choruses around, and let's just kind of show us some hands, if you will. When you all currently are doing performances, I'm understanding that most of you are requiring proof of COVID vaccination to participate as a chorus member, orchestra member, soloist. Is that true? Can we give a thumbs up? No, sometimes, yeah. So Sten, that looks like we got an awful lot of folks with a thumbs up here, saying yes, we're doing that. And most of us are still wearing masks as we are performing as well. Is that right? All the way along. And most of us are also still staying spread out, right? 3 to 6 feet. Kind of iffy, okay, a little iffy, not so much. I see. So that's really one of those that it seems to be questionable. What about the space that we're in? Are we still trying to be like in the sanctuary, so to speak, instead of in the choir room to get ready? Is that, yeah, pretty much. So we're trying to at least use volume for the room to keep us all in the same space. And how many of you actually were able to work with your wherever you rehearse, perform, on knowledge about the air handling system? Is it doing what you think it's supposed to do? Yes, no, don't know. Don't know. Okay. All right. So I mean, I just thought that would be good for us to kind of get a sense of what we're doing. So I guess, Sten, the first question is, I think we all feel confident we're doing the right thing, but then we're starting to ask the question of when can we loosen up? So let's just start with the question of those masks. And let's talk about choral groups, large groups, and then we'll go to soloists, and then maybe to our auxiliary instruments, etc. How are you feeling about continuing to wear the masks as a chorus?
Okay.
Packed together?
So rather than answer directly, I want to give you just 2 minutes of background.
Okay.
So this is what COVID case numbers reported to the State Department of Public Health looked like in early January. Weekly numbers. This is what it looks like today. Ignore this bar, which it mysteriously appears in the state report this week for no good reason. That's the number, 1546, okay? So you can see that since mid-February, we've had a tiny fraction, a 30th, a 40th of the cases that we had at the peak. Why is this? 3 reasons. Number 1, high vaccination rates, one of the highest in the nation. Number 2, Omicron being very, very infectious, sweeping through the population of unvaccinated people. And number three, the result of those three is that there are very few susceptible people right now. So any of us can get COVID, but we're unlikely to get sick and we're unlikely to be very infectious because we're vaccinated and boosted. And then you go down a little bit, these are deaths. And you can, this is over the entire lifespan of the pandemic since autumn of 2020. There was a big peak here, as you all know. And we had a huge peak in the winter and a slightly smaller peak in the next winter. And now we're in April, and last April rates were low, now they're even lower. So that's all I wanted to show you. So the background epidemiologic circumstances in the state are highly favorable. We only have about 35 inpatients in all 5 hospitals of the Yale New Haven health system. That's Greenwich, Bridgeport, Yale New Haven, Lawrence Memorial in New London, and Westerly in south eastern Rhode Island. So we used to have 600. And we have 1 in the ICU this morning in all 5 hospitals. We used to have 200 in the ICU in all the hospitals. So circumstances are much, much improved. Furthermore, if you are vaccinated and boosted, you are unlikely to get very ill. It's more like a bad cold or a mild flu. And you're exceedingly unlikely to get hospitalized or die. So the consequences of a COVID virus infection now are quite modest compared to what they used to be. So it is definitely time, if you are vaccinated and boosted, to relax about your own health. If you have diabetes, you're at so much higher risk. If you're battling cancer, you're at higher risk. If you have substantial heart disease, you're at higher risk. But if you have anything mild in that category, your risk is not that high. Like if you used to have cancer and you think you're cured, your immune system is rebounded, you're fine compared to me or somebody else. So now let's get to the topic at hand, which is choral music. We have a major tool today that we didn't have 2 years ago, vaccination. And we have a second major tool that we didn't have 2 years ago, easy to obtain and highly reliable testing. So if I were running a choral group in Connecticut today, I think it's prudent to require all my choral members to be vaccinated and boosted, and my patrons to be vaccinated and boosted. That's a cautious, conservative thing to do, and it will increase consumer confidence, because we've got to rebuild consumer confidence. And that's a non-trivial exercise given the fear that people have had over the past 2 years. So that will help circumstances. And if you were to keep the first 2 rows free of the orchestra and your chorus was recessed a bit, so that when you're singing, you're a good 12 to 20 feet away from the first patron, that's also reasonable. And you could ask people to do the home test, the so-called antigen test, which can be purchased from any pharmacy now. You can even send get online to the federal government and get free ones from Joe Biden. So if you test all of your orchestra members prior to rehearsals, and they all test negative, then the likelihood of transmission amongst that circle, I know they go home to their families, I know they go to work, but still the background incidence rates are so low that if you test negative coming in, the likelihood of there being a mass transmitter event like we had in 2020 in the famous choir in Washington State is exceedingly remote. And if you want to be really careful, You can test at the beginning of rehearsals, and then you can test just before the concert. And if anybody tests positive, they're out. But if they test negative, then they're in. And under these circumstances, masks would definitely be optional. Because if nobody's infected, what are you wearing a mask for? You see what I'm saying? So that's the tool that we have. We have, not only we have vaccination, such that if you do get infected, you're likely to have a much lower viral load and be much less infectious to others. And second of all, we can test and make sure you're not infected. And we can test in an affordable, convenient way. So, you know, you're saying, Vermund, you're a public health guy, and here you're telling us to put our masks aside. What's the matter with you? I'm just telling you what I think. I'm not a state official. I'm not running the CDC. But as an academic who studied infectious disease epidemiology for 40 years, there is not much point to wearing a mask when background incidence rates are as low as they are now. And when we can, in a group event like a chorus, a choir, you can actually ensure that everybody's vaccinated and you can test before the series of key events. So that's my viewpoint. Now, if you have a regular venue, that, you know, a church or a concert hall where you routinely perform, you can certainly consult with the building engineer and say, look, how are we doing with air quality? Is it possible to ramp up the air exchange rate at the time of a concert so that we have maximum filtration of the air? Is it possible, not today, but in a 2 weeks, to open the windows of the church to maximize airflow? The more you mimic the great outdoors, the safer you are, because the more dilutional effect you get. So these are some thoughts about where I think we are with choral music in Connecticut at the present time. But now let me try to tackle your questions, perhaps.
Sten, before you go to the questions, let me just fill in one piece. I don't know if you all know, but we did work out a deal with a donor to help us get you testing if you'd like it. So there, we got the price down to $5 a test. You have to buy groups of 25 tests.
Wow, that's a bargain.
Yeah, so it's a really good deal. Actually, Tuesday we're giving we have about 3,000 going out the door on Tuesday. So if you'd like to, again, contact Shoreline Arts Alliance at office@shorelinearts.org and we'll help you with that. Okay. Go ahead, Sten. Tackle away.
I see the two questions here. One from Emily and Henry. Governor Ned Lamont has COVID. So does Speaker of the House Nancy Pelosi. So what's happening is you go to, you know, the gridiron dinner like Nancy did. And I don't know what Ned did, but when you have as many social contacts as politicians do, where they are continuously in large groups, and that's the whole point of being a politician, is to network and to build your political base, etc., then you're at higher risk. So the more, you know, we still have our healthcare workers wearing masks because they're seeing patient after patient after patient, and many of them have respiratory syndromes. So the prior probability of an exposure of somebody who has that lifestyle, a healthcare worker, a politician, is much higher. If you are one of those people where you're interfacing with dozens and dozens and dozens of people every single day, I would think a mask would be very prudent and very wise. But I'm not like that. I have my Zoom calls. I have the occasional student, the occasional faculty member I'm seeing face to face. Yale is still requiring masks for classrooms. We don't require masks other than that. But the classroom setting where you're sitting there for 2 hours and you're sitting close to the person next to you is thought to be a place where we should be especially cautious. And so I will not argue if you want to retain masks. That's not irrational. It's not foolish. It's not, you know, nervous Nelly. It's a perfectly reasonable thing to do. But if you argue that we have university vaccinated audience and performers, and we have the ability to test before rehearsals, before the concert, and we're going to forego masks, I think your risk would be quite low.
Okay, thanks, Sten. I'm going to start calling on some folks here.
Well, let me just answer the second question from Tom. Do we need to require people showing their vax cards? Now, that's the million-dollar question. Do you go on the honor system, where you make it clear on your website, you make it clear at the door, you make it clear everywhere that somebody has to be vaccinated, and then you don't bother checking? Or do you check? A third approach is to simply require unvaccinated people to mask. And then you could even have unvaccinated people. They probably got the Omicron COVID virus 4 months ago, and that gives them partial immunity. So they're probably not as high risk as they were a year ago. But those are programmatic decisions that you can make at the management level. The extent to which you want to open up and democratize your audience.
Great. Kit Foster, you have your hand up.
Oh, it's left up from
okay.
from earlier, but I do have a thought on this, or information. Eastern Connecticut Symphony does require masks, vaccination. You have to show a vax card to get in, although they don't scrutinize them terribly carefully. But they do have that you have to make that act. You have to
right.
You can't just show up.
Well, New Haven Symphony Orchestra has continued to wear masks in the performers who can, like the strings and percussion. Obviously, they're not requiring masks in the people who can't. And they are not requiring it in audiences.
David, I know you had your hand up for a while. Do you still have a question?
I think Sten sort of addressed it, but I'm curious if other people have thoughts, because it kind of goes to the governance question of if let's say we adopted a policy of saying we're going mask optional for, and that everybody should test at home before rehearsal. And, if you test negative and you're vaccinated and boosted, no mask required. How do people deal with the question of whether that's honor system or you're requiring some evidence? I realize that's a maybe group by group policy decision, as opposed to a medical decision per se. But is there any view from the group on how to handle that?
Well,
go ahead, Sten.
Well, just a thought. For your performers, is there any difficulty in asking them to bring their vaccine card, and then you record it once, and now you know? Is that controversial, or?
No, we've already done that for vaccination.
Good. So we're talking about the patrons.
It's really the test. It's really the testing point that if we shifted to a policy of saying we're going to unmask in rehearsals, let's set aside concert for the moment. But if we're going to offer unmasked rehearsals, provided that everybody's, gotten a negative antigen test that day or immediately prior or whatever the standard is, do we ask people to certify or just show up, or bring a photo of their test result? I mean, how far do we take it? And again, I realize that's more of a policy decision perhaps than.
I'm guessing that your performers are going to be very socially conscious and concerned about their neighbors. And if you ask them, I expect you'll get an honest answer. That's my guess. And with patrons, you have a more fundamental decision, which is, are rates low enough in the state now that it doesn't matter if they're vaccinated or not? the likelihood of them being a nidus of infection to a group is minimal. And having a nice big sign saying, welcome back to the so-and-so choral group. If you are not vaccinated, please wear a mask and have some masks there. And so you could do it that way and forget about screening your audience for vaccination anyway. Now, what if somebody my age walks in, sees that sign, and promptly does a U-turn and walks out, outraged that you're not requiring vaccination in the patrons? You see, that's what I mean by restoring consumer confidence. It's not just a matter of doing a reasonable and prudent thing. You may have people who have been absolutely living in terror of this virus for 2 years and are going to have trouble adjusting to normality. And they're going to feel much more comfortable at your concert if they know everybody around them is vaccinated. And that's what I mean by this being a management decision, not so much a public health professor decision.
Yeah, that's something we all have to figure out for ourselves. I know even for my board meetings, my whole board has followed every one of these meetings, and still we are not having our meetings in person just because there's a couple folks who just aren't ready. And,
yeah.
and so we're not. So, you know, you got to think about those folks, and, you know, everybody in my organization is totally behind moving this forward. So Carol, I want to make sure we talk to you a little bit, because Carol, this was your idea tonight. Thank you for asking for this. Carol sent me a lot of great questions, and so everybody should give Carol the thumbs up for urging us to have this meeting today. So, so Carol, what have we not covered? What do you want to cover?
I think what we haven't really covered is probably, I mean, we've talked about vaccinated singers, vaccinated orchestra members, and so on. Sten, am I hearing you right if I assume that what you're telling us is that you would not allow people who are not vaccinated to come back to singing as a choir member at this point?
Yeah, that's a rough one, because if you're not vaccinated, you're the one who's going to get COVID. We still have 1,500 cases every week in Connecticut, and
Right.
they're overwhelmingly in unvaccinated people. So the unvaccinated individual is representing more than 75% of all the inpatients in the Yale New Haven hospital system. And the other 25% are typically not as sick. So it really is a risk for someone to be waltzing around unvaccinated. And for them to be a performer, I almost think about a performer the same way I think about a nurse or a doctor. So I'm a pediatrician. If I decide I don't want to get a flu vaccine, or I don't want to get a measles vaccine, or I don't want to get a COVID vaccine, then I'm susceptible. And if I pick that up in the community from my family, I bring it to work and I transmit it to my patients. Now, what do you think of me as a pediatrician? I hope you think of me with contempt, if that is my attitude. And I have the same view of people in a chorus. Why would you not get vaccinated to protect your fellow choristers and yourself? What is the pathology there that we need to work out? And I think tough love is sometimes a very good mechanism to get people to do the right thing. We do it with our teenagers, and I think we can do it with our folks in the orchestra or in the choir. And if you say, we would ask you to be vaccinated and boosted in order to rejoin the choir, then you may lose a couple of people, but everybody else will be like the doctors and nurses, people you can be confident have done everything they can to avoid transmitting to others. Am I being too harsh?
No, that's the approach we've taken for the past year. So I'm actually relieved to hear that you think that that's a sensible approach. Thank you.
Well, you know, in public health, we have, some of you have heard me say this before, it's like a fulcrum. And individual liberty or communal responsibility. And you know, you're in the US, we look like this. You're in Cuba, you look like this. Very little individual liberty and everything's for the community. And it's not unreasonable to be somewhere in the middle and maybe even biased towards the community in the middle of a pandemic. And then when we don't need to be that strict because of the pandemic, we can shift back to the traditional American, you know, live free or die attitude. But in the middle of a pandemic, we want to introduce a potentially infectious person into a group dynamic where we're aerosolizing. That's what we're doing to create our music. It doesn't make sense to me.
Thanks. I think we've pretty much covered the other questions that I raised in the document I sent to you, Eric.
Mhm.
Other than perhaps the one about whether there's any information you can share, Sten, about the latest variants and trends that we
Sure.
should be aware of as we plan
Sure.
forward for concerts coming up.
Right.
You know,
So
where are we
there-
going?
Yeah, we had the old Wuhan strain. We call that the ancestral strain, the first one to make the leap from animals to humans. And that went away when Delta showed up. And Delta had a strong competitive advantage. And the ancestral strain went to near zero and Delta went to near 100%. Well, guess what? Omicron shows up. And it's so much more infectious and so much more efficient in transmission that it pushes Delta out of the way. And the next thing you know, Omicron is 100%. Now, mercifully, Omicron wasn't as lethal, wasn't as pathogenic as Delta. So if you got Omicron, you were less likely to become sick. Now, you saw that slide I showed you of the surge of cases, and there was also a surge of deaths. So unvaccinated people or people at especially high risk still risk dying even with Omicron. But for most of the rest of us, Omicron was more of a nuisance virus than it was a lethal virus. But now the BA1, but now the BA2 has shown up and it is displacing BA1. So it has some competitive advantage that we don't fully know why. Maybe it's a shade more infectious, but it doesn't look more lethal. And the really great news is that 2 doses and a booster are very good against all these variants. And 2 doses and 2 boosters are likely to be even a little bit better. So right now, CDC has said everybody over the age of 50 should consider a second booster if you've had your last one within 4 or 5 months, more than 4 or 5 months ago. And if you are especially high risk, so if you have you may be 30 years old, but you have a chronic disease that is immunosuppressive and puts you at higher risk, that would be another group. So my wife and I are not rushing to get our second booster, but at our convenience in the next few weeks, we'll go get a second booster, which is, you know, thoughtful, prudent thing to do. But the 2 doses and the booster are really good at all 4 of these variants.
So on that same point, then, you're not expecting a major surge like we saw in Europe coming out of the BA2 taking over?
Yeah, a couple of things about Europe. First of all, they normalized pretty quickly, and they probably overdid it. We've been much more cautious in our normalization, so that probably didn't help them. Secondly, the standard in the UK, for example, is the AstraZeneca Oxford vaccine, which is a very similar vaccine to the Johnson & Johnson vaccine. It's a live vector. So you engineer the COVID protein onto a live viral carrier, a benign virus that doesn't cause you any illness. And that is not as immunogenic as the mRNA vaccine. So we're recommending everybody who got the Johnson & Johnson to get boosted with the mRNA. And in Britain, they didn't do that. So they just boosted with the AstraZeneca again, and they didn't get as robust a response as we are getting with the mRNA. So there are some reasons why they had a bigger surge in Europe than we've had here. And I think those reasons will persist over the summer. Keep in mind, too, that we are now out of respiratory virus season. So all of the respiratory viruses, influenza, parainfluenza, respiratory syncytial virus, rhinoviruses, echoviruses, enteroviruses, they're all more common in the winter. And they all diminish in the spring because we have warmer air. We're not today, but we typically have warmer air. We're outdoors more. The air is moister. So cooler, drier air indoors is why we have these surges of these respiratory viruses every winter. And that is mitigated by spring and summer weather. So we've got a lot going in our favor. We have high vaccine rates, vaccination rates. We have low transmission rates. We've got spring and summer coming. Personally, I would be shocked if we had a major surge in the spring and summer. I think it's very unlikely. Now, all bets are off next November and December when we have respiratory virus season kicking in again. Then I want to know a lot of things I don't know now, which is how well have we done with boosters? And what does the BA2 look like? And is there a new variant that's shown up? And how good have we been to get second boosters in the more vulnerable and elderly folks? And so, you know, we may have a mess next winter again, but I doubt that it's going to be a big problem for our summer. And that's a consideration when you're considering your outdoor events and your summer events. And, you know, I think things are going to be quite benign.
Sten, this is once again eye-opening. Thank you so much for helping us find clarity here. I know we said it was 20 minutes with Sten, and now it's 40 minutes with Sten. So, do you need to run, or are there any more questions here in the gallery?
There's
And
another one in the chat
go
from
ahead.
Maggie there.
Oh, is
let's
there?
look at that one. Sorry. Okay, Maggie says, if we see an increase in cases, at what level would you change the advice you're giving? Thinking about a May concert, European surge, we're so far not seeing here. Right now, we're bouncing around at a very low level, and I would not overreact. For example, we had 25 inpatients in the 5 Yale New Haven Hospital System hospitals. And then we had 30, and then we had 35, and then we went back to 30. We're bouncing around at a very low level. So I wouldn't overreact to any of that. I showed you the state data and how it's lower last week than it's been in any week. And by the way, the sludge data, you remember that we're testing sludge because you can detect coronavirus genetic material in feces. And sludge is a good assessment of an entire community. All of the fecal matter that's going down and being collected, concentrated in sludge, we can use this sensitive PCR test and see, and we can use a semi-quantitative approach and see how much burden there is of virus coming into the sewage treatment plant. Down, 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 down. Every week less than the previous week. So don't overreact to a little blip. That probably is nothing. And if things are serious, we're going to let you know about it. The State Department of Health and the governor are going to make a fuss. I don't see it happening.
Okay, well, this was great. Thank you all so much for taking the time out tonight and keeping our communities safe and doing all the great work that you're doing. Again, Sten's here, I'm here. Anything we can do to help you. I'm so glad Carol reached out to say, let's do this. Thanks for doing that. We just want to help in any way we can. So Tom, is that a wave goodbye, or is that?
Oh, no, I wanted to say I sent the chat out, but with all the good news about how we're coming out of the virus season, I just wanted to invite everyone. The Shoreline Chorale, which is what I represent, is having our 40th anniversary concert. It's been long delayed, and we're having it on May 7th at the Clinton Town Hall. And if
Great.
anyone would like a comp ticket, I put my email in the thing. Just send me a note and I'll send it out to you. We'd love to see you. It's a big house, 400 seats, and we're not going to fill it, so there'll be plenty of social distance around you. So.
Thank you. Actually, great idea, Thomas, Tom, for doing that. And also just throw your emails in the chat so we make sure that they've come to my desk, not just everywhere else that you sent them. So I'll leave the Zoom running here for a minute. If everybody wants to dump their email in there, that would be super. And also so we know where each of your organization is.
If you just hold on for 1 second, I'm going to give Kit what he asked for in the chat. So wait a minute, all panelists and attendees here. So Kit, if you go to this website, what you'll do is you'll see this pop up, and you can course down this page and get all sorts of interesting things like a map of the state. This used to be solid red not so long ago. Wow, solid red. And you can get aggregate data about the state and age groups, etc. But more interesting, you can go to the weekly extended data report. Just click on it and you see what's coming up. This is a document. You can save the document on your computer, or you can just look at it here. And if you just course down here, you'll get to right where what I was showing you. This is by county, and this is what I showed you. And I don't know what happened there with this oddball gray bar. It's an artifact, so please ignore it to the far right. And then dates of death for the deaths in the state, and the dates, and lots of other information. And you can save that website if you like, and go back and forth and see it anytime you like. They have daily reports if you're really a glutton for punishment.
Okay, thanks, Sten. Thank you all so much. I'm so glad we're all getting out there and sharing your great music with the public. Keep doing it. Make sure you put those dates on my website so people can come to your concerts. Okay, we have an event page that you should be on.
Yeah.
All right.
We'll do that. Great.
Okay.
Thanks,
Make
everybody.
sure you're there. All right. Take care, everybody. Have a great night. Thank you so much,
Bye-bye.
Sten. We
Thanks,
so appreciate
Sten.
all your help.
My pleasure.
Wonderful job.
Okay. Bye-bye.
Bye. Thanks, Eric.
Tom. Thanks. Thank you again, Carol.